Hi friends, good evening and welcome to my channel. Friends, we will see some important exam based point. This is the video number 57 of important points section. We can see the points. First point, an example of cardiac glycoside is digoxin. So digoxin is one of the example of cardiac glycoside. And the next point, trade name of digoxin is lanoxin. And the next point, therapeutic level of digoxin is 0.8 to 2 nanogram per milliliter. That is therapeutic level of digoxin. And the next point, antidote of digoxin is digobind. And the next point, another name of thromboangiitis obliterans is Buerger's disease. So Buerger's disease is also known as thromboangiitis obliterans. And the next point, acute inflammation of lymphatic channel is called lymphangitis. So lymphangitis is an inflammation of lymphatic channel. And the next point, the infective organism commonly result in lymphangitis is hemolytic streptococcus. So hemolytic streptococcus is the causative organism of lymphangitis. And the next point, average lifespan of platelet is 7 to 10 days. And the next point, average lifespan of RBC is 120 days. And the next point, abnormal decrease in RBC, WBC and platelet is called pancytopenia. So abnormal decrease in RBC, WBC and platelet is called pancytopenia. And the next point, another name of heartburn is known as pyrosis. And the next point, absence or ineffective peristalsis is called achalasia. Okay, and the next point, another name of dumping syndrome is called vagotomy syndrome. Dumping syndrome means rapid emptying of gastric content into the intestine. So that is known as dumping syndrome is also known as vagotomy syndrome. And the next point, expulsion of gas from the stomach through the mouth is called belching. And the next point, hydrogen birth test is used to evaluate carbohydrate absorption. So hydrogen birth test for carbohydrate absorption. And the next point, urea birth test is used to evaluate Helicobacter pylori. And the hydrogen birth test is for carbohydrate absorption. And the next point, normal serum creatinine level is 0.6 to 1.2 milligram per deciliter, and normal blood urea nitrogen level is 7 to 20 milligram per deciliter. And the next point, normal uric acid level is 2.5 to 8 milligram per deciliter. And the next point, blood in the anterior chamber of the eyeball is called hyphema. Blood in the anterior chamber of the eyeball. And the next point, medication that cause pupillary constriction is called myotics. Myotics which cause pupillary constriction. And the next point, medication that cause pupillary dilation is called mydriatics. Mydriatics which cause dilation and myotics which cause constriction of pupils. And next point, blind or partially blind areas in the visual field is called scotomas. That is blind or partially blind area in the visual field. And the next point, a condition in which there is a deviation from perfect ocular alignment is called strabismus. And the next point, junction between cornea and sclera is known as lymphus. So junction between cornea and sclera is known as lymphus. Thank you. These are all the points.